what is causing your inner elbow pain? Is it really golfer's elbow? Today's video will be discussing a differential diagnosis for different causes of inner elbow pain. We don't want to treat something with a misdiagnosis and not improve, as it can affect our performance, our function, and our ability to work. There's several causes of inner elbow pain, one of which is golfer's elbow, which we'll discuss separately in a different video. However, we want to differentiate from golfer's elbow compared to other conditions, such as cubital tunnel syndrome. See our previous video for more detail on it. Also, ulnar nerve neuritis. We can also have growth plate injuries in the younger population, particularly overhead throwers like pitchers. There can also be a tendinopathy or trigger points from some of the musculature of the inner forearm muscle. So we really need to make sure that we have an accurate human movement diagnosis to know if it's truly golfer's elbow and not something else. How do we differentiate between the different causes of inner elbow pain? If it's truly golfer's elbow, you'll feel when you flex or bend your wrist and pull up and in that the tendon, the common tendon on the end of the inner arm bone called medial epicondyle is what indeed causes your pain. If I resist this down and away forcefully and that causes my pain, that more is likely golfer's elbow. Next, if I tap on what we call the funny bone, which is really a nerve called ulnar nerve in the cubital tunnel, and that causes my pain, now I'm thinking more cubital tunnel syndrome or ulnar nerve neuritis, especially if you're getting radiating symptoms down the inner forearm like achy pain, numbness, or tingling. Next is the inner triceps can, believe it or not, give you inner elbow pain. So if I extend my elbow and press on my medial head, inner head of my triceps, and that radiates pain to the inner elbow, now I have tricep trigger point pain, referred pain to inner elbow. There's also some injuries that can occur on the elbow from repetitious throwing, like ulnar ligament, particularly the anterior or front band of the ulnar ligament. This leads to the very commonly known surgery called Tommy John surgery. So we want to make sure that you identify the appropriate mechanics in your pitch, which we'll do a whole separate video and series on, to decrease the stress and strain of the inner elbow. One thing that's important for inner elbow pain is what's happening above it and below it. Any restrictions at your wrist, hand, and forearm or shoulder above can lead to excessive stress and strain to the inner elbow. Let's talk about the shoulder. Any restriction of shoulder internal rotation can definitely lead to more stress and strain on my inner elbow. In other words, if I don't have enough humeral rotation, particularly internal rotation, stress and strain will collect down to the inner elbow. Thus, everybody should check this movement on themselves. Lay down on your side, put your body weight on your shoulder blade. Keep the shoulder and arm at 90 degrees. Reach for the ground or table. This angle should be 60 degrees. This is known as the sleeper test, and we should have 65 degrees of internal rotation. If you don't, you're at high risk for shoulder injury and elbow injury. You'll see in my body that the right does not go as far as my left. This is common in the more dominant upper extremity. So check your right or your dominant versus your non-dominant and get this back to 65 degrees. This is known as the sleeper stretch. An initial starting dose is 3 times 1 to 2 minute holds. I do this almost every time after a heavy workout or a day where I use my upper body, particularly my shoulder and elbow, a lot. We want to make sure we diagnose the true cause of the stress and strain to the inner forearm. So this concludes our what's really causing your inner elbow pain video. This is Dr. J with the Human Movement Institute, where we have improvement through movement.